spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
Welcome, everybody, to Live with Dr. Carolyn Dean here on AchieveRadio.com. This is Ginny Gunther, also known as Ginny Almighty, and I'll be your host tonight, too, along with Dr. Carolyn Dean.
Phone lines are now open at 602-666-6027. That's 602-666-6027.
We'll be taking your phone calls from around the world and right here in the U.S. Welcome, everybody. It is Live with Dr. Carolyn Dean here on AchieveRadio.com. And yes, it might be Memorial Day. And yes, people might consider this a holiday, but we do have an international customer base that is not even aware of what's going on here in the United States. And we like to do the show because we love to talk about the amazing things that we get to experience every single week with our customers and those who are using the Completement formulas to experience health, vitality, and well-being in even greater measures than they are used to. And I have to say, I was reading a book today, and it said in the book that if an individual can create a solution that is something that solves a problem for both men, women, and children, regardless of race, gender, or creed, that person should be considered a genius. And so immediately, of course, I thought of our very own Dr. Carolyn Dean, who has created a solution that is applicable to everybody around the world. Man, women, and children can use the Remag Magnesium, our minerals, and all of our natural, perfect nutrition for every level of every single person on the planet, and that makes her a genius. I'm so thrilled to be associated with her this evening, so thrilled to present her to you. And before I bring her on the show, I just want to remind everybody that not only is she a genius, and we've established that, but she's also a medical doctor and a naturopath, an herbalist, an acupuncturist, a nutritionist, a lecturer, consultant, and author, and also a person who's so generous with her own body, mind, and spirit that she would spend 2 hours on a holiday talking to people about the thing that they require to know from her, information on how to use her formulas and how to improve their health, vitality, and well-being with all kinds of modalities. It's not just limited to what we offer through RNA Reset. She did graduate from Dalhousie Medical School in 1978. She has a medical license in California. She's a graduate of the Ontario College of Naturopathic Medicine, and she's so influential in so many ways. We're so happy to have her here with us again this evening. Welcome, Dr. Carolyn Dean.
Thank you, Ginny. Whoa, frogs in my throat. Good to be here. Thank you. That is pretty neat. Solution that applies to everyone around the world. And this is what we've got with Remag. And it's interesting because the topic I'm going to go into about physician burnout. People who look at what we're doing as just selling a product have no conception of what we're talking about. And perhaps until they try it themselves, until they get in such a magnesium deficient state, then can't find a solution, and then they'll come to Remag. But that's okay. We'll wait patiently for them. So let me dive right into, I did a blog. It wasn't about physician burnout, but that's what some comments came to me about it titled. So it was a blog that I took the title from a Medscape article, Healers in Need of Healing Cannot Heal. And I think what annoyed me first about enough about this article to write a blog about it and, be able to rant my opinion, and I'm grateful to be able to do that, to be able to have a blog. We live in a country where we have freedom of speech. So I think what kind of got my goat with that title is that doctors are not healers. Doctors in present-day medicine, allopathic medicine, are not healers. That is not a word that you can apply to most physicians when you go to their office, spend 7 minutes, walk out with a prescription that's going to give you side effects. And that is the general consensus of at least in our world, Ginny, where at customer service you hear all the complaints about doctors, and I certainly hear them when I used to do consulting. So what happened is after that went out, I had a number of people that emailed me and said, yeah, right on, that's exactly what's going on. And actually, if you haven't read it, it's at drcarolyndean.com. But what I outlined was in the article, they started, the two doctors that are writing it, and I think they are psychiatrists, and they're saying there's a triple aim in healthcare that was introduced in 2008, and triple aim is enhancing patient outcomes of care, good, that's what we need, improving population health, yes, and reducing costs, well, yes, definitely. But then these doctors are saying, but if 55% of doctors are saying they're burnt out, according to a study back in December 2015 that I did blog about as well, if 55% of doctors are burnt out, how are they going to help people, which was my question as well. So they wanted to change that triple aim and make doctors' health number one. Let's get our doctors fixed, and then they'll take care of patients. And that was just too much for me. It's like, doctors have had all the opportunity in the world to be a good doctor and take care of patients well and have good outcomes, but, that's just not happened. So what it turns out this doctor's a psychiatrist and deals with doctor burnout. That's her specialty. And, right off the top, she says, I just read your response to the Medscape article about physician burnout. Are you really suggesting that using your completement formulas would be more effective than physicians considering what's happening inside themselves, other medical professionals, leadership, and medical organizations, and trying to evolve? It's kind of a confusing statement, but that's kind of what the article was saying, that they wanted to get doctors in leadership positions or make them more in a leadership role in their patient population, get the medical organizations appreciating doctors more, all this talk. And, of course, the nub of it was she's afraid that I'm just trying to make money off my formulas and not considering the whole picture. Well, I've been at this for, if you consider before I even went to med school, my interest in natural medicine, I've been at this for 50 years, and it's not been until the past 5 years that I've found something that really works for people. As Ginny said, for everyone around the world, including doctors. If you feel burned out, take magnesium, but make sure it's Remag. So my position, I wrote back to her, we went back and forth a few times, and I said, doctors have their medical school expenses, their mortgage, their families to care for, and they can't afford to do anything outside the box. And, to expand on that, it's like they are so boxed in, they're never going to change. They're never going to have an opportunity to be better doctors or get outside the system of drugs and surgery. I've talked about this many times. Doctors are under such a close scrutiny, either in their HMOs, their prescribing practices, or computerized. They cannot get out of the box. And I'll probably say it later on, but the gist of the whole conversation I had is that doctors, in prescribing all these medications and not just sort of getting to know their patients, using some common sense, consoling them when they need it, telling them, no, take a few days off work, let me write a prescription so you can have a few days off work and take care of yourself. Just simple things like that instead of it being all about giving a prescription. So they don't have time for that, though, because that takes more than 7 minutes to talk to their patient. So they get themselves in this vortex of giving a drug that doesn't help. The patient comes back and blames the doctor, maybe not outright, but look, doc, this drug didn't work. I'm feeling worse, do something. And how is a human being going to feel day in and day out if even a quarter of the patients are not happy, satisfied, getting better, or getting worse? I mean, that will eat at a person's psyche. And yes, they're going to get stressed and burned out because they don't have time to take care of themselves or their patients. And that's where the burnout comes from. So to have management skills, classes, and intuitive training is not going to change the system that's causing the problem. So this writer goes on to, quoting me where I say, believe me, this inner journey process is never going to happen in the medical world, and I believe that. She may believe differently, the doctor who's writing me. I just have to go back to Medscape again and look at the title of an article. Dean Ornish, who was the maven of low-carb diet for heart disease that made big inroads with his study. Well, he's written some more books or papers, or he's got one in Medscape called Dean Ornish on Love and Connection. It might be an interview. And then, okay, that's fine, Dean Ornish on Love and Connection. Great, oh my gosh, they're actually going to introduce something. Then there's a bracket, and it says the touchy-feely stuff, and bracket. So they give it a complete put down. Yeah, you don't have to look at this, you science-based doctors. This is just the touchy-feely stuff. That is what imbues medicine with its ridiculousness of training doctors to be heartless from day one instead of compassionate. I mean, I've always said that medicine was a soul-destroying experience. If I didn't have Bob to, bring my soul back every night after my med school or my internship, it's I don't know. It didn't even have an ethics class when I was in medicine. Another student and myself had to start a noon-hour weekly ethics class, so a course or whatever we called it, where we brought in movies to train, help us understand how to deal with patients who were, half of them was burnt up or they needed counseling on AIDS, AIDS hadn't even been created by that time. So there was no ethics class. We made the administration feel so guilty they threw one together for the following year. But those are, the initial comments that she made. And then she said, you really read that article and feel it's a complex hodgepodge of contradictory directives that are meaningless in a system that everyone knows is not working. Egad, I respectfully suggest you read the article again. I said, look, the article is about doctors learning to be leaders and developing management skills as a bureaucratic strategy, and it doesn't work. Becoming a leader to your patient in our present medical system just means they trust you enough to take your drugs and go for your surgery, and still end up getting worse in many cases. When they began to prescribe, when doctors began to prescribe drugs preventatively, everything went downhill. When the drug companies, produced the kind of pseudo studies that seem to say that taking preventative medications for cholesterol and blood sugar and blood pressure were beneficial in some way, then people on these drugs started getting cumulative side effects. So, to train a doctor to be a leader so that patients will become compliant, I think is absurd. And, the reason why I keep saying it's never going to change is because in order for medicine to change, it has to accept magnesium for one thing, nutrition, exercise, lifestyle, the basic common sense things, and spend time educating patients about this. So then she goes on and says, I feel very sad that you've been subjected, as so many others, including me, have, to abusive medical training experiences. I also feel sad that you feel so sure nothing good can ever happen in this situation. And I take offense there to the direction this psychiatrist is taking. I don't like the use of the word sad in this context. Sad is a word that people use to make a person feel less than. Oh, I feel so sorry for you. Feeling sorry or sad for a person weakens them. It's a put down. Watch how people use it on you. Don't accept it. What people should feel in the context of abusive medical training is anger, outrage, and refusal. That's what I did. I refused to buckle into the system. And they think they attacked me on it and could stop what I was doing, but it just gave me more energy and, I've ended up in Maui, et cetera, is what I always say, where they're still stuck back in freezing in Ontario. But no, this is, don't say, oh, I feel so sorry for you. There's nothing there. That's a very psychiatric way of abusing a person. In my view, I think she's saying this now. In my view, we have many intelligent, heartful, creative physicians and other health professionals. I believe we can develop a strategy together that moves everyone, including patients, forward. In fact, I believe we must do this, or the nearly 200,000 medical error-related patient deaths will continue. I have faith that we can do better. I'm not as cynical as the thoughts you express. Well, I'm very positive in terms of contact or interaction with the public and with my patients and customers. I'm just cynical that the system is not going to change, and it's been like that for centuries. I said here in my notes, I'm cynical about doctors changing, but not about how individuals can take their health and lives back. I mean, I get the emails today. What was it? Someone said how much better they're doing on their magnesium, and their doctors still, in spite of 3 or 4 things improving dramatically, their doctor still wants to put them on statin drug as a preventative and something else. And she said that they were not in the least bit interested on her improvements on the magnesium. So how are you going to get through to doctors who've been brainwashed by the media and then in medical school to not believe in anything other than drug-based therapies? I'm not going to, there was so much more that she went into, but I think, two of her main points were, she says, don't reduce the suffering of so many of our colleagues. There are over 400 suicides yearly to a marketing message to buy your supplements. So she thought I was, sort of attacking doctors while they're down and also selling them supplements. And, of course, I would say, well, they're suffering because their adrenals are shot, and if they did feel healthier and happier, they might do better. I mean, we have so many doctors now who don't even feel they have to sell the supplements. They just tell people to come to the website, and they get very excited when dozens of their patients come back to them and say how much better they're feeling. I mean, that's what makes doctors feel so much better. And as I said earlier, there is great psychological damage to a doctor hearing from many of their patients that they're feeling sicker and sicker on their drugs, and the doctor has to defend their use all the time, every day. And about the 400 suicides, I mean, that is regrettable. But in my Death by Modern Medicine book, I'm documenting 1 million needless deaths annually from various forms of medical iatrogenesis. And, of course, in my 600-word blog, I was focused on the patients, but in their Medscape 3,600-word article, the doctors didn't focus on patients hardly at all. And, there's really no focus on changing the system into one of more choices of care with herbs, homeopathy, minerals, etc. And what we keep hearing on the media is attack after attack on alternative medicine. So, that shows, what's going to happen in the future with alternative medicine. We're going to be left on our own without doctors to guide us because they're going to be afraid to go into that line of work. And, she did end up saying, I'm sincerely glad and grateful for your work with magnesium and so many other things. However, people like you and me need to use our influence to increase understanding and collaboration, not add fuel to an us versus them model. I'm sorry. I'm really, I suppose I don't want to add fuel to the fire. I just want people to know that when they look at remodeling the healthcare system, it has to come with alternatives. You cannot keep just using drugs. I don't think I've blogged about it yet, but there's huge headlines out now that they've the organisms, the bacteria have broken through the last drug, antibiotic drug they had, because every antibiotic has now a drug resistance, so that what they're saying, it's the end of chemical medicine, the end of drug medicine. I don't know if that's true, but it's big headlines. Mike Adams did a whole article on it. And what it means is we really have to look at the alternatives, like I talk about in Future Health Now Encyclopedia, the silver, the homeopathics, the high-dose vitamin C, and the magnesium. In Magnesium Miracle, I talk about the work of a doctor in Paris who found that magnesium was an excellent antiviral. He used it on polio, etc. So I would love the research to go there, but they've had an opportunity to do that with all the drug-resistant organisms for decades, and there's not a peep out of medicine or the pharmaceuticals to go there because it can't be patented. So we are in a bind. This is why I educate constantly on people getting healthy, staying healthy. I've managed over the years to kind of, not even consciously, almost unconsciously, come to the point of figuring out with my own health and my patients' questions what the body really needs. And that brings us over to Ginny's blog about cellular health. But I'm going to stop there to see if Ginny has any follow-up or questions about my little diatribe here.
No, perfectly said and well-spoken and very passionate on your part, and it does intersect perfectly with the topic, because you are, addressing this issue of, doctors and burnout and leadership. I saw that in Indianapolis when I worked in philanthropy, and the Lilly Foundation gave incredibly generous renewal scholarships to clergy. And you could apply and you could get a renewal scholarship, and they would pay you up to $75,000 to take time off of work, out of clergy or whatever, so that you could become renewed and refreshed and find purpose and passion again for what you were doing, because people serving other people, even at the clergy level, which was my area of expertise at the time, get burned out. And so, but what they found after doing this for many, many years and supporting all kinds of, clergy and taking sabbaticals, which, of course, is a biblical principle of the Sabbath, the day of rest, nothing happened. As a matter of fact, many times they took the sabbatical and they never went back to pastoral work or clergy work, right? Because if they get 5 minutes of a break to get their head on straight, they're like, this is crazy. I am killing myself to try to save other people who are killing themselves. And, it just turns into a rabbit hole. So, you're absolutely right. And, it doesn't even mention anything about the people who also work alongside of them, like nurses, and what, their whole scene is, which is horrible and horrifying. And you're absolutely right. They have to add, alternatives. And then to get to the next point of the conversation, which is where you're going, the most hilarious thing of all is that at a cellular level, nobody can even prove that these drugs even work, because it's not what the body requires and hasn't required for, tens of thousands of years. So why all of a sudden now in the last 30 years does the body just instantly start to require all these chemicals to function? It doesn't.
Yeah.
Not at all.
Perfect. Yeah, Bob's ready to pounce in. What do you say, Bob?
When she condescendingly said, I'm so sad for your attitude, did you respond to that?
No.
You didn't, whatever she said in that email?
No, I wasn't fighting or being defensive, but, it didn't really hit me at the time as hard as it did and as I express it, because this is, it's a construct that doctors, psychologists, psychiatrists use to placate, and look like they're being compassionate, but it's a less than position that they're putting you in.
So you're responding now to that level, to
Correct.
That point.
Right.
Did you indicate to her you were going to talk about her?
Yes. Yeah, she may be on the line, actually.
Yeah, I think there needs to be more dialogue here. There's many points you haven't said that she doesn't know you could say.
Right. And it's okay. I mean, she might email me as well, but I think, we both expressed ourselves, and, I'm not going to wave a flag or a banner to support doctors who, can't work. If they've put themselves in this system and they can't work in that system, then they should get out and do something that makes them happy.
And you genuinely believe, I don't think you told her this, your products will make them feel better, no matter how crummy doctors are being.
It's true. It's true. I mean, we get that feedback all the time.
Yeah, they can feel better and continue being dumb doctors. But they'll feel better because they made themselves better with your products.
They can, but see, then what I did mention is a lot of doctors, they'll tell Ginny or tell me, tell customer service that they're telling their patients to come to our website and they get the magnesium and they go back to their doctor, oh, thank you so much, you saved my life. They're in the position now of being the instrument of a person getting better. And so that makes them feel better, and, with even that little bit of incentive, they can continue on. I mean, it's not the solution because the damage has been done and is still being done. It's been done for decades, centuries.
What's not the solution?
Just telling people to take magnesium, what this... And it's never going to happen. I mean, how many times have I been asked to participate in some grand project? The last two have been about veterans. Oh, I've read about your magnesium work, and the veterans, look, they're filled with drugs and vaccines. They're all on meds. They're all depressed. They're overweight. They drink too much. Everything. High blood pressure, high cholesterol. They need magnesium. Send me all the studies that show that this will work, and prepare a proposal. And I say, read my book. It's all in the book. If your funders don't want the it's like make work projects. It starts with you give us a whole bunch of information, and then we'll put it in somebody's hands, and then they'll dissect it. And all these organizations do is they'll get the money for their salaries to do this project. They'll go to the companies and ask for free products to give to the veterans, and supposedly do some study. It's never happened in all the time that.
What's never happened? They never did the study?
Never did the study. I've never. How many times I've told you that people approach me for this, that, and the other. And I just get minimally involved enough to, give them a bit of support, and then I just watch it all fall apart.
So they don't have the conference.
They don't have the conference or the study. No. Okay, so we got to move on, Bob.
Yeah, but just that point about we make the doctor feel better for himself. Mm-hmm. Then he might tell the patients, oh, you should take this too. Mm-hmm. And then they might start feeling better.
Yeah, so it's a long, drawn-out process where, it may never happen because doctors are actually afraid to talk about nutrients in their clinics or in their offices, because if it gets out to the other doctors that they're doing something different, they could be ostracized. I mean, it's a horrible system.
Yep.
Yeah. And going to Ginny, are you okay for me just to go over to your blog now?
Sure, of course.
Yes, Ginny sent out the blog from the RNA Reset website, and it's called Building Blocks to Cellular Health. And yes, the cells are the most important. I think what's happened in medicine recently is they're talking about the mitochondrial cells and trying to figure out all the pathways of the mitochondria. And I've said many times people should be able to repeat after me that in the mitochondrial processing and production of energy, the ATP, six of the 8 steps require magnesium. So the first thing you do if you want mitochondrial health, if you want energy, is you take your magnesium. And to get into the cells, you need a good water intake. The sea salt in the water provides those 72 minerals that the body requires that we haven't even studied all of them yet. So the hydration and the minerals, we have the remite too for the other 12 minerals that are really important, especially for the thyroid. So when all these minerals are absorbed into the cell, they pull water in after them, hydrate these incredible cells, and let them do their work. And it's as simple as that. We are hydrating and healing and helping and we have down here millions of cells, and it is trillions of cells. And each of those cells has their little job to do, and if they don't have the right building blocks, they just won't do their job. So basically, we're talking about macro and micro here. You know, the microcellular level has to be supported, and in patients, you know, your lifestyle, the decisions you make about your health, they have to be supported. A couple of emails I wrote today for customer service with patients, you know, one of them, I think I already said that their doctor wouldn't even acknowledge how much better she was doing with the magnesium. And, you know, another is just really wondering about her doctor pushing her on drugs. She says, I'm a 58-year-old female. This is patient burnout. That's how I'm looking at all these emails we get from patients now, is they're just burned out with what they are having to put up with. She says, I'm a 58-year-old female who developed an abnormal heart rhythm in January. I had taken on a stressful job the year before, and my teen went through a major depressive episode in December, and it may have been too much for my heart. I've blogged about broken heart syndrome, too, that the stress on the heart can actually come from just straight stress and cause heart symptoms. I researched and found you on the web, started on magnesium, which helped tremendously. It was almost immediately a night and day difference. I'm eating more magnesium-rich foods. I feel 90% better, but still seem to have the irregular beats when I get sick, overly tired or upset. So she doesn't have her mineral stores built up. She's only taking like a maintenance dose. So that's where, you know, we talk about the therapeutic dosing of Remag, where you don't get the laxative effect, and you can finally get the effect that helps you at all levels. I'm working on meditating, taking better care of myself. I do not take the prescribed calcium channel blocker. My cardiologist wanted me to. Her first choice was a beta blocker, and I had a horrible experience with them 2 years ago when I tried to take them for high blood pressure, so I would not consider it. So she talked about her high blood pressure, about abnormal heart rhythms, about massive stress. So it's magnesium deficiency. But she says, my cholesterol is 280. Now, med school, our average or our high normal was 240, 245. They want you to be 180 now. So, yeah, the doctor is really going to be pushing her for statins. She's only on Armour thyroid, afraid of long-term effects of prescription drugs. And, yes, when a patient goes to a doctor and says, you know, I really don't want to take drugs. You know, I'm afraid of side effects. Well, you know, if you don't take them, you're going to die, is what they'll say, and that's what sets up the stress from a diagnostic stress that I talk about in Total Biology. She says, back to the calcium channel blocker. Will a calcium channel blocker interfere with my magnesium intake? By the way, my cardiologist nor my regular doctor are the least bit interested in talking to me about the incredible improvement I've had since taking my magnesium. They're almost annoyed by it. What do you think of that, Ginny? Well, her words are, they almost seem annoyed by it. Now, how does that even compute in my brain where, you know, a patient is coming in and feeling better and it bothers the doctor because it's on a non-drug therapy that they don't understand, that they can't be in charge of? I mean, it's very sad, basically. So that would, what I'll be doing with a lot of my mailbag emails now is saying, here's another patient burnout email, because that's what these poor folks are going through. And who knows how many people are committing suicide because they're not getting their questions answered. So, back to you, Ginny.
Yeah, I agree. Well, It's a good thing we have you, Dr. Dean. That's what I have to say. That's what I have to say. Yeah, absolutely. All right, so let's take a couple questions from the InQuick and the chat lines, Carolyn, and then we'll proceed. 602, also, let me just announce how you can call into tonight's show. If you're listening through your computer or you're on your phone, 602-666-6027 is the number to call. That's 602-666-6027. And then when you get to the studio, you've got to hit star 5 on your keypad. That will raise your hand and let me know that you have a question or comment in the studio, and we'll put you on the line with Dr. Dean. A couple questions here, Carolyn, from Monica, no location. Is it okay to give homemade liposomal vitamin C to a 2 or 4-year-old? The vitamin C made from rosehip powder. Thank you for letting me know, Monica.
Yeah, I've never been asked that question. Well, if you would give rosehip powder to a child, which is just like a food. The other is, what do we make it with? Lecithin. And lecithin is safe to give to kids. So I would think it would be perfectly safe because it's just a couple of foods that you're giving.
Okay, very good. Excellent. Question from Patty. First, a little bit of a testimonial information. She says, my name's Patty. I've been taking Remag and Remite and RNA drops, not consistently as I tend to run out and don't have the next bottles reordered. I need to order in bulk. Anyway, in my short time taking Remag and Remite, about 4 months or so, I've noticed a significant improvement in my energy. Initially, I did get a little bit of diarrhea, but also I take vitamin C, magnesium glycinate, new to constipation I've experienced for years. I figured out all the dosing, so she got herself all straightened out. Then she says she's getting some for her sister and her mother, so she can't wait to see what their results are. But she does say, a problem I do have is I'm seriously concerned about my hair and scalp. I'm experiencing flare-up around my temples and behind my lower back of my head and scalp. It's itchy and my hair is falling out. Is this a sign of candida? I have a feeling it is. Testosterone and estrogen. I feel my health is improved. I'd like to stop taking them and just rely on Remag and Remite, but I really need to help to understand what's going on with my scalp.
Right. Yeah, I don't quite know. Is she losing hair? I mean, yes, and it sounds like seborrheic dermatitis in a way. I'd be looking at the B vitamins, and actually that means our Realign. The Realign has the methylated Bs to cover for all the methylation problems they're finding now, and it has the precursors to glutathione for detox. But yes, so Realign, make sure you're on your 1.5 to 2 teaspoons every day of the Remite for your thyroid, and take note of when your thyroid, either on blood testing or your pulse becomes elevated, where you might not need your thyroid medication again. So it is being consistent. You've told us you're not consistent, and it's like in AA you have to identify your problem. So if your problem is inconsistency and not taking your supplements, then nobody can change that but you. So just make notes on your fridge, your calendar, and everything, just to get more consistent. It becomes a nice habit, and that's the most important thing, because it will help hair loss. The Remite will support your thyroid, etc., for preventing hair loss. And look at the Candida treatment as well. And with the bioidenticals, what you do with them is just really take as little as you can to treat your symptoms. Sort of wean back and see if you have any symptoms without them. Because yes, as you improve your Remag, Remite, RNA drops, and Realign, then things should balance out. And maybe Patty is taking the Realign. I don't know. She didn't say she was, but that could also cause some of the detoxification coming on the scalp, and the Realign alone would help. So, yeah, interesting question. Thanks, Jenny. Thanks, Patty.
Very good. Excellent. All right, a question here on the chat line. Does magnesium malate give you more ATP or cellular energy?
Well, the malate, there's one of the, biochemical steps in the making of ATP is a malate step. And that's where people decide, let's take magnesium malate, that should help. But see, the problem is in the form of magnesium, because the magnesium malate is only going to be, 10, maybe 15% absorbed. See, we don't know for sure, but I know when I tried magnesium malate, it gave me the laxative effect immediately, so I know it's not absorbed. So maybe you're getting something, but just eat some apples. The malic acid in apples will be probably as much as taking tablets.
Very good. Excellent. All right. Now, here's just another thing Jenny learns after 4 years of listening to Dr. Dean.
Eat apples.
Eat apples, an apple a day. It's so funny because I've been on this apple kick. I've been craving apples. I've been eating 2 or 3 a day, and out of nowhere. And I'm like, I wonder what's behind that. Apple a day keeps the doctor away. So, maybe that's it. It's the malate in the apple. Oh, my gosh, how hilarious.
Yeah.
All right. Very good. Always learning something with Dr. Dean. My goodness. Okay. Our good friend Gordon Carolyn is typing in and saying, do you have any insights regarding lithium orotate? I got a message about it, and they're making fantastic claims, and I think you remember, Carolyn, that's that one that Dr. Mark Millar is all hepped up about it because of the PTSD for the veterans and that kind of thing.
Yes, there's a recent book on it, actually, a Kindle book that I downloaded, and the find of the century, and I mean they've got some compelling information there, but the lithium, I mean, we do get it in our food. It's in the sea salt. You can really overdose on it. I know they're talking about low dose. If people wanted to experiment with it, and it's very low dose lithium, I'd say it might be interesting if you have symptoms that haven't been addressed by the complement formulas. It would be interesting. It's not something that we'd ever put in our shopping cart, but I don't know what else to say about it. I think when you read the promotion for it, it reads like every other fantastic thing, even reads like what magnesium can do. But, what I'll tell people when they write me and ask me about this or that, should I take this, I'll say, not until you're saturated with magnesium, because a lot of the symptoms that things like low-dose lithium say they're treating, it's really magnesium deficiency symptoms. So if you can do the magnesium first, and then if there's other stuff left over, then you can experiment with other things, and you should be able to get some good feedback if your body's clean and clear and magnesium saturated. It would be interesting to see if other things enhanced how you're feeling. But Gordon, you've heard people on the show phone up year after year and say, well, I've had another great year and I'm feeling even better on the complement formulas. And also we'll have people who after a month say, well, I'm not 100% better. Should I try something else? So we're just here to tell you to stick to what you've been doing and what's shown to be beneficial and keep it going until, until when? How long should they keep it going, Ginny? I guess forever, right?
Well, they have to do it forever because you are going to be living forever. I mean, you just can't, just kind of pop off and decide that it's just like, people always say, do I have to do this forever? And it's like, well,
do you want to live forever?
Right, yeah, that's what when is the body ever not going to require magnesium? That would be zero time. So I say no. Now, what about, you used to also recommend Empower Plus.
Oh, yeah.
How's that similar, different to this lithium business they're talking about?
Well, the Empower Plus, they've probably got lithium in there. They have, I think it's, 50, 60 different nutrients in there. It's pretty much a scattershot of everything. And I just got into recommending because I know the people who make it. I know they're very ethical. I know it's working. I know they've done all their homework. They've done dozens of studies. They've got like 80 to 90% effectiveness on clinical trials. I mean, it really does work. And it's something that I don't want to treat depression over the phone when I was consulting, so I would advise that. But what I tell people who are on the complement formulas is they probably don't have to add as much Empower Plus. They have to keep up their magnesium because it doesn't have enough magnesium. But it probably has lithium. It's definitely a standalone supplement for someone who's not on anything else or maybe just on their meds, and they have great customer service and even consulting where people can help them wean off their medications. And, that's the biggest problem in the mental health world is the amount of medication people are on. Apparently 1 in 4 women are on antidepressant or anxiety medications, and that's just wrong.
Oh, my gosh. Okay. Wow. Okay. Excellent answer, Carolyn. Thank you so much. Very comprehensive, Gordon. I'm sure you can do a lot with that information, and Jenny was interested in it, too. Okay. Now, Pierre from, I think he's in Hanalei, Hawaii? Am I saying it the right way? Okay.
Nope.
I'm not saying it the right way? Okay.
I don't know which one. There's Hana. There's
Hanalei.
Hanalei. Yeah, Hanalei.
Hanalei. Okay, very good. All right. He says, even though I miraculously converted back to NSR, somebody's typing and moving my text here. Hold on, people. Even though I'm miraculously converted back to NSR after 4 months using Remag, Remite, and Realign, the doctor has ordered a nuclear stress test and is talking about having me taking flecainide. Oh, dear. What on earth? I am concerned with the nuclear dye and the drug as well. Can you discuss this? Also, is Remag assimilated in the intestines?
Okay, Remag, if it gets to the intestines, it'll be absorbed there without needing anything else to help it. That's what's awesome about the Remag. It doesn't need any an intact gut to be absorbed. In terms of the getting the testing, if you're in normal sinus rhythm, which is what NSR is, then it's up to the doctor to prove that you need invasive testing, and certainly the flecainide is not something I'd ever take because it has 6 fluoride molecules, and even though the doctor will say, well, they wouldn't give it to you if it was going to break down into fluoride, and maybe even the doctor, if he had any time in the world, would come up with a study that says, well, in the lab, flecainide does not break down to fluoride. Well, in a gut with trillions of bacteria that want to break down these drugs, it can break off into the fluoride molecules. So I know you feel especially in a small island like ours without enough cardiologists. Maybe you have to change your cardiologist to someone who recognizes that you're doing better and you don't want to do invasive testing. And I guess the way I would approach a doctor is to say, well, I'm doing so much better, and you humble yourself a bit. You cannot attack these folks. You say, I'm doing so much better, I'd like to give it more time before I do the testing. You do not say, I'm never going to do your testing and storm out, because then you've got a battle. You say, just give me some more time and I'll do the test later. And then as you get better and better, you've only been on them 4 months. It took me actually a year and a half where I was finally over my palpitations. You just keep putting it off. Oh, I'm sorry, I have to go out of the country that day. I'm going to have to reschedule my appointment. You play it the way you want to play it. But at the same time, you have to be reasonable. If you are having palpitations, etc., you want to keep in touch with your doctor and you want to know the status. Read the AFib book again and SB's story about how she went in and out of her symptoms. But see, it's easier for us, Pierre, when someone says, I'll never do a drug, I'll never do a test, and then they go from there. But if you're swayed by doctors, it makes it more difficult. And
very good. Excellent.
Right.
Very good. Excellent first hour, everybody. We've got another hour to go. This is Live with Dr. Carolyn Dean. We are going to take a quick break, let Dr. Dean wet her whistle with some great Remag and Remite water, and we'll be right back after this message.
With host Jimmy Gunther after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
If you're so much God that you came forth to separate yourself from your power and then created all these ridiculous, inappropriate, in every way, chasms that are impossible to get out of, no matter what you do, that you have to stagger through this ridiculous thing called life and die a little bit every day, what is the damn point after a little while? If you have to bring yourself so full circle that then you have to ask others to help you get the bumps off your breast, for Pete's sake, do the math on that. Now, we're glad that she is compassionate and tells you what to do and that kind of stuff. But come on, what's forever for? Get on with this thing called life and live in or get out. It's so much easier. It's simpler because then you come into your power and it's more liberating. Because in your liberation, then you can go, oh, okay, I have power to say, oh, I can control this. Oh, this works for me. Oh, I see how it goes. Oh, this is nothing other than a shift. Carolyn is the best through all of it to say, you're there and you got to come there and we got to go.
AchieveRadio.com.
We return now live with Dr. Carolyn Dean, along with your host, Ginny Gunther, here on AchieveRadio.com. Skype us at ar.call.in. That's ar.call.in.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
If you're so...
All right, welcome back, everybody. Thanks for tuning in. Again, Hour 2 of Live with Dr. Carolyn Dean here on AchieveRadio.com. Welcome back, Dr. Dean. I just wanted to let you know that Pierre from Kauai said thank you for your response. Aloha and malaho.
Mahalo. I know, it takes a while.
Oh, my gosh, how hilarious.
I wonder if he knows Ed Long over there.
Oh, very good question, Pierre. You can type in and let us know. Yeah, he said he had AFib for 4 months and converted after a month of working with the formulas. Yeah, absolutely. Excellent. Happens. I can't eat an apple as I have an immune response to it. I take the malate. I have heart palpitations for several years. I've never taken prescription medications. I'm 62, sometimes suffer leg cramps. Anything you suggest. I need to heal my leaky gut. I cannot have eggs or something else.
Right. Well, take the Remag and Remite. You don't have to worry about the gut for absorption. You can keep taking the malate. It's not necessary. I know when I tried it, it didn't seem to do anything for me, but other people it might. But just take the Remag and Remite and see how that goes for you. We've got so many testimonials from people who've had, all the range of symptoms, chronic fatigue, fibromyalgia, low thyroid, and everything. And they have irritated guts and all the rest of it. But you can take care of all that and just go slowly on the Remag and Remite.
Excellent. Okay, a quick question too, Carolyn. I got a couple questions that came in right before the show that I didn't get a chance to send you, but one of the gentlemen wrote in and was questioning specifically, I'm going to read this to you really quick. I became ill several years ago with mycoplasma pneumonia. Pneumonia. Oh, my God, what's happening to me tonight? Pneumonia, which took a long time to recover from. He had difficulty running during that time, and his legs hurt terribly. He got cured of the mycoplasma and not able to run, but he went to go to a doctor who was treating him with various homeopathic solutions, and this doctor recommended your book and to try Remag. To what you said earlier, Carolyn, doctors are recommending the products right out of their office, and he said miraculously within 4 days of starting Remag, I was back to running 30 to 40 minutes at a time. I feel better than I have felt in years. Thank you so much. I am continuing to take a teaspoon in the morning and one at night in water, and I feel great. Today I ran for 45 minutes. My question is that I also seem to be suffering from ED. Sometimes I'm able to get an erection, and sometimes I can't get one at all. The desire is there, but the mechanics do not follow. Is this related or not with the the pneumonia and also subsequent magnesium deficiency, using all the antibiotics? What would you recommend, or what should I do to remedy this situation? I'm not taking any medication whatsoever, simply vitamins and your magic Remag and Remite.
Oh, he's on Remite. Well, the Remite is going to be helping the ED, erectile dysfunction, with the zinc and the other minerals. But, I'm wondering, I'm looking up mycoplasma pneumonia and see if they use Cipro with it, because, the possibility is that they gave you fluoroquinolone, and the Cipro can really do a number on magnesium and affect different organs. So it just might take more time. I'd recommend if you've been on antibiotics, as you would have for the myco, to do the Realign and the RNA drops as well. The Realign to detoxify, do deeper detoxification, and the RNA drops to build more perfect cells. The more we learn about this Cipro business, and the FDA has black boxed it again. I have no idea why they don't take it off the market. It's killed enough people that they should put up the stop sign. Someone emailed us after last week's show. One second, let me clear my throat. and sent an article about the FDA doing the label changes on the fluoroquinolones, including the Cipro. And that was my first thought. They should have just taken it off the market. So when we talk to people about their past history and find out they've been on a lot of antibiotics, I used to just think, oh gosh, then they've got yeast overgrowth, which is another possibility actually now that I'm talking myself into this. Yeast overgrowth can create the 178 different yeast toxins, some of them which can block hormone production. In terms of testosterone hormones and erectile dysfunction, they have shown that magnesium does help testosterone production, but I would say your main treatment would be Realign RNA drops and the yeast detox. So there.
Very good. Excellent. Excellent. Live with Dr. Carolyn Dean here on AchieveRadio.com. If you're listening through the computer or even on your phone, 602-666-6027 is the number to call to talk with Dr. Dean tonight. And then once you do, you've got to hit star 5 on your keypad, star 5 on your keypad of your phone to raise your hand in our studio, and I will take your phone off of mute and put you on the line with Dr. Dean. If you want to just type a question in through the public chat room, you can do that too, or use the private and quick messaging system here at Achieve Radio, that's Studio A. And if you're listening to the archive and you're provoked with a question, you can email support, SUPPORT, at rnareset.com, and that will get your question to Dr. Dean during the week, and she will respond. Pierre also asked one more question. I am on Xarelto. What is your opinion of this drug?
Xarelto. Let me look it up. Xarelto. Even though Wiki is yucky, I will look up on Wiki. I wonder. Okay, Xarelto. Okay, that makes sense. I usually look up drugs and to find out the chemical formula of them to see if they have fluorides. And ribavirin, it does not have a fluoride molecule. It's the anticoagulant. They'll put people on it for fibrillation just so they don't build up clots in the heart. If their heart, if the blood doesn't leave the heart, every second, if some stays behind because you have an irregular heartbeat, they're concerned that blood may coagulate because it's sitting there. It's what they use as a way to get people on anticoagulants, the fear of a blood clot. So Xarelto, once you start bleeding with it, you can't stop, is the concern they have with it. I think there's another drug out now that can stop the bleeding of Xarelto. But if when you get your next testing done and your heart stays in normal rhythm, you should not have to be on an anticoagulant. What I say in the AFib book is to look at the nattokinase and serrapeptidase, natural anticoagulants that they apparently use in Japan, and use that as a alternative. But you research it first. So you've got two things. You probably won't need it because you're in the Xarelto much longer because you're in normal sinus rhythm, and you can use the alternatives, nattokinase or serrapeptidase.
Okay, very good. Excellent. Wonderful answer. Thank you, Carolyn. Excellent, excellent, excellent. Mm-hmm. Okay, so let's see. Let me go and check and see if we've got any callers, and if we don't, Carolyn, we can do some mailbag things from your end because I know you've got questions that have come to you. 602-666-6027. No waving hands. Okay. Let's see what else we can.
Okay.
All right.
We got a ton of mailbag, and what I'm looking at is a patient burnout letter. this person says, I just received my magnesium RBC results. I'm a 68-year-old male with high blood pressure, high cholesterol, type 2 diabetes, restless legs, sleeplessness. So what are all those symptoms? Magnesium deficiency, every one of them. I take 2 different meds for high blood pressure, losartan and clonidine and pravastatin, so it's a statin drug as well for the high HDL. Now, though I didn't have a chance to look up these, I don't know, I don't think they're fluoride drugs. They don't strike me. The clonidine is for high blood pressure. It's not a statin drug. The losartan is another, it's angiotensin. No, they're not. Now, it doesn't mean they're safe to take. It just means they're not horrible. So the statin drug was just increased from 40 to 80, so each time you go to your doctor, you'll be put on more because you keep losing more magnesium. So far, no meds for diabetes. And, the way he says that, it's like, well, that'll be on my next visit. But he takes allopurinol for gout. I have digestive and constipation problems recently, probably from the extra drugs. My wife has given me probiotics, CoQ10, vitamin D, hopefully not too much, multi-omega-3s, Juice Plus, and now magnesium. Watching our diet, cut our protein intake, increase fruits and vegetables, making bread from scratch. I have approached my doctor in the past about possibly being magnesium deficient, because I have so many of the symptoms, and requested he send me in for the magnesium RBC test rather than the serum. I just received the results, and it shows I'm at 2.1, which is about halfway on what normal range is. Now, a 2.1, if that is not a magnesium RBC test, so he's been swindled already. That's a serum magnesium. If he's 2.1 in magnesium RBC with a range of 4.2 to 6.8, he is way in the basement of magnesium. And he took some magnesium before the test, ordered our Remag. So I feel the doctor will say I was wrong about possibly being magnesium deficient. What do you think? Do you think I'm taking enough given the medications? Appreciate your opinion. Now, so I told him the 2.1 is a serum magnesium test, and your doctor will say your test is normal, but as you know, all your symptoms are magnesium deficiency, and all the drugs you're taking will just lower your magnesium more and more, which is why doctors say heart disease is incurable, because they keep draining your magnesium and making you sicker. I've answered your question about magnesium deficiency in all my articles and books, so read the Remag book to understand the epidemic deficiency of magnesium in our population. Also, the dosage question is answered in the Remag book. Some people need 900 to 1,200 milligrams. He was taking 400 to overcome symptoms, drugs, and stress. But over time, the magnesium builds up in the body. It's in storage. And then a person can wean off their meds as their symptoms and signs improve, and the doctor should help you with that willingly. Just become more educated about magnesium so you understand how to heal your body. So it's, you see not most, but some of my time now is being spent in how do you, couch your interaction with your doctor who's not going to believe you and is going to try to put you off from taking your magnesium. And I did go into a lot of that in the AFib book because they get beat up the most by their doctors because doctors are afraid of them throwing a blood clot and having consequences from a clot. So they want you on all the meds, and not because it cures you. It's because they're covering themselves if anything happens. If they, if you throw a clot and you have not been on an anticoagulant, it could come back at them.
Hey, Carolyn.
Yeah, Bob.
I'm so glad you never became a doctor.
Thank you.
It's been great.
Yeah, you love it. Okay, this one is a question from a woman who's trying to help her mother. And, it's another thing we have to deal with. So the daughter says, I've read a lot of your texts, seen you speaking on YouTube, and that vitamin supplement. Needless to say, I'm a total convert to magnesium. I really appreciate all the freely available information you give. Thank you. Upped my dose, had profound improvements in my pain levels, overall health, using Remag, Read Light, Excited. Not writing about myself, but my mother. Now, this is what, we talk about all the time, people's symptoms, but she's desperately unwell, will not listen to a single word of advice from me. Now, that to me, okay, I can't work with someone who won't listen. So, but I took this as a learning or teaching story about how do you deal with this. And the daughter goes on to say to me, despite being a witness by telephone and Skype to my gradual recovery and repair from total exhaustion 3.5 years ago, which led to a migraine so severe I could not stand up straight for 3 months, and aftershocks, I've talked her through my food allergies, vitamins, and supplements, energy, producing yoga, stress relieving, cutting out meat, to reduce acid, and on and on and on. In the meantime, she's carried on with her standard sad diet, not too dissimilar from the American one. With her fatigue, she cooks less, so they eat Chinese takeaway. So on and on and on.
Hey, Carolyn.
What?
I'm so glad we didn't create a family.
No, you're so glad we don't have parents.
Yeah, and kids, and this whole problem of having being a family day is so ridiculous.
I know.
I know that goes against the heart of most people, but I seriously am very happy. We never went through the normal family thing. Kids going to schools, whatever the hell they do.
Oh, yeah,
so
and getting vaccinated without permission. Oh,
Jeez.
I know.
If people want to know why I'm happy, that's one of the main reasons.
No kids.
I didn't participate in most of society, the cliche part.
Okay, she thinks organics are a rip-off. I mean, at the end of this girl is going to ask me to consult with her. Man, do I run the other way. They continue to use weed killer, don't even put a mask on, spent a month in hospital at the start of the year for smoking-related issues, so she's smoking. Issues with blood flow to her foot. Both times she's been saved from amputation. Rushed to the hospital with severe migraines. I mean, it's, using morphine. Extreme urinary infection lasted weeks, required heavy-duty antibiotics. Listen to this. She was so badly infected, she became delirious, fell out of bed, and broke her arm. She wouldn't take probiotics. She went through 2 or 3. I mean, it reads like a disaster movie.
Why does she think she has a family or a mother? I mean, the person doesn't listen to her.
No.
It's so ridiculous. People get over the idea you got to have a family.
Yeah. They mucked around with her epilepsy medication. She had a seizure, first one in 15 years, autoimmune, rheumatoid arthritis, osteoporosis, skin rashes. Some days I'll call and she could hardly move her hands. And yet when I beg for her to please get some magnesium, she cries and tells me I'm bullying her. But she did kick her white wine habit, not sure about her tobacco, on and on and on. My question is, would a telephone or internet consultation for my mother be possible, please? She goes on, I don't know what else to do. And I said, I can appreciate you wanting to help your mother, and you've done your best, and you know that the rest is up to her. Even if I were still doing telephone Skype consultations, I would never consult with someone who is that resistant to taking care of herself. You can't bully someone into taking a common-sense approach to their health. Allopathic medicine has made a mess of people's lives by bullying them into taking drugs. It's just not an approach I would ever take. What you do at this point is never talk about her health again unless she asks. And if she tells you that she's doing what she's doing and you don't agree, you tell her, you know what's best for you, Mom, and that's that. I get the feeling from the amazing overview that you gave, she enjoys the conflict of defending her position against you. And once you stop pushing her, she has nothing to push back against, and then she will have to face her own health for once. Please use your energy to stay well and live your own healthy life. So then she writes and thanks me, and she says she understands what I'm saying, and she says there are a lot of stubborn, sick people around her who don't want to get better. So, and she's happy with me talking about this case for educational purposes. So, she's saying that since she read my articles and upped her dose of magnesium, life has been so normal again. Chronic pain and fatigue are like a distant memory. So, that's how you deal with burnt out mothers who are resistant to your help, or just, we get more on the other end, mothers trying to help their daughters. But either way, you just do what, show by example and then move on. Right, Ginny?
All right. Absolutely, yeah. Move on is what I'm thinking. Yeah. But, yeah, definitely.
Okay. Now, the next one, that was about the fluoroquinolone. I already did that one. And then we have not been able to get on the show. Please ask Dr. Dean about cartilage regeneration, if it's possible, and what minerals are necessary. Now, we've had some people who've had problems, were going to go for surgery and didn't have to. We haven't conducted studies on it, but for that, it would be all the complement formulas. It would be the Remag and Remite, which will help build cartilage, but also realign to clean out the cells that may be in the way, and the RNA drops to make the perfect cells. And spraying the Remag directly on the knee, and doing gentle exercise. Don't go immobile. Keep working the joints. If you have a problem, sometimes the pain of in a joint will get people just to stop, and that actually can usually make things worse. Dr. John Sarno, Sarno, he was either an orthopedic surgeon or a physiatrist. He wrote a lot about that. The next one, someone is saying, I bought a bottle of your magnesium, found it really helpful. I used to be a chocoholic, but I found I no longer needed it when taking Remag. Then I ran out, and as I live in the UK, it's hard to get over here. She said she tried another liquid magnesium from Amazon. Very bad idea. I was back on the chocolate in a short time. So I've reordered your Remag. You may be interested to know that the type of chocolate matters. So what she's talking about here is magnesium is very high in chocolate. And so when we hear about women, especially around their periods, craving chocolate, we say, well, you're craving magnesium. So she's kind of proven it there. So that was a very interesting story for us. This next one, I think this came in weeks ago, and I probably answered it to the individual. She says, I'm a nurse, history of fibromyalgia, mitral valve prolapse, Sjogren's, chronic muscle discomfort, tightness, hypotension, periods of palpitations, extreme dry eye. I've researched the conditions extensively, modified my diet, taken magnesium oxide and citrate in a bone supplement plus 250 additional mag oxide. Now, bone supplement, that means it's a high calcium. After reading your book, I got the magnesium RBC test. My level was 5.5. Then I started on your Remag, 300 milligrams over the course of the day. Continued the bone supplement, dropped the extra 250 mag oxide. Now, 2 months later, and spending she gives me her whole economics, spending money for the remag and for the tests. She says her values went from 5.5 to 5.2. So it's my fault that her levels haven't gone up. And she's frustrated as a professional and as a consumer that evidence to date is only anecdotal, and my lab reports are showing that I was better off before remag. Now, what we know about this is that when you start using magnesium that's going to get into your cells, it's going to use it up. It's going to make it not be in your blood as much anymore, and you can go through a transitory drop in your magnesium levels. And I was just talking to a doctor the other day who's invited me to a medical conference, and he's using Remag, on dozens of his patients, and he finds the same thing, that within the first 3 to 6 months, your RBC magnesium levels will go down, and it's because the Remag is being utilized elsewhere. And if people don't understand that dynamic and they just look at their levels and not even look at how they're feeling, then they'll think, they're not getting there's not the magnesium in the Remag that I say there is. So, I mean, that's something customer service knows, but it's hard to tell people who, this person claims she's, science-based, a nurse, all this and that, but you don't just go by the blood test. And
did you answer that? Did you tell her this?
Yeah. Mm-hmm.
Okay, and you didn't hear back?
No.
Yeah, see?
And the other thing is, too, that the magnesium RBC is not the perfect test for this situation. I think I said it last week. Yeah, magnesium is not high in the red blood cells as it is in other cells because there's no mitochondria in red blood cells. And it's in the mitochondria where we have the 6 of the 8 steps require magnesium. So it's gonna pull in a lot of magnesium into cells that have mitochondria. So yeah, people who just focus on the blood tests and not looking at their body, don't really get the right impression of what's going on.
Yeah, that's really great that your doctor friend, he's becoming so knowledgeable about our products. He notices this pattern. It's going to get worse. That's really good.
Mm-hmm. Yeah. I mean, we've seen it, but to have it confirmed in, dozens of patients, that was cool.
Yeah.
Where am I now?
It really is a situation. You always were told by different intelligent people to don't identify with what you're doing with people. Don't identify with the healing. Mm-hmm. That's a very wise position. You can't worry about the people. The millions of people are not going to listen. Mm-hmm. You can have fun with the millions of people who will listen and get benefits. Mm-hmm. That's a really key thing. You have to remain quite detached about how successful you're being.
Yes, because you'll get someone like that who will just not understand the dynamics and
may not want to understand it. A lot of people like that, they just want to remain sick or screwed up.
Right, like the mother. Anytime her daughter said do this or do that, she felt. She was being attacked. Some people just need their conflict. Okay, the next one, similar to the cartilage one, this woman had RSD, reflex sympathetic dystrophy, after meniscus tear in the knee, had 3 sympathetic lumbar blocks. I don't know what that means. Maybe injections in the lumbar, weight gain because of Neurontin and Nobec, as well as cortisone. So there's all our medications, along with physical therapy twice a week. Others who've had full knee replacements done can practically run by me. So she had It looks like she had a meniscus tear, just the scope. They put a little tube in your knee and clean away the debris of a meniscal tear. But then the reflex sympathetic dystrophy happened. Let's just look at that, because people do come up with this where it's a group of symptoms including pain, often burning type, tenderness, swelling of an extremity associated with varying degrees of sweating, warmth, coolness, flush, and discoloration, shiny skin. And it's damaging. It's from damage to a nerve complex. Let me see if they describe it better. Continue reading. Nerves. Theories include irritation and abnormal excitation of nervous tissue, leading to abnormal impulses along nerves that affect blood vessels and skin. Involuntary nervous system, peripheral nerves, and brain seem to be involved. The exact mechanism of how RSD develops is poorly understood. Now, as soon as I read that with anything to do with muscles and nerves, I think, okay, this person probably went into the surgery with magnesium deficiency. Nobody knew it. The irritation from the surgery caused the irritation, inflammation around the nerves, and nothing has been able to touch it. Injections in the lumbar spine, 3 sets of drugs, physically 58. I was very active before all this. Can you advise? So that would be saturating yourself with Remag. It would be healing the nerves and the muscles in that area from the original depletion, and then trying to heal from all the drug intervention as well. So I think this is the problem with a lot of people with these, we don't know the diagnosis, but man, this person has a lot of pain, enough that we're giving triple drugs and doing surgeries, etc. So magnesium deficiency until proven otherwise. And I would say all the complement formulas would be important here, because you want to build up new perfect cells. You want to clean up the toxicity from the drug intervention. Cortisone might be causing some yeast overgrowth as well. So yeah, that's my thoughts on the these complex cases. But remember what I said: if it involves nerves and muscles, then you have to look at your magnesium. Someone's question here about folliculitis. Now that's where the follicles of the hair get inflamed and even infected. Folliculitis of my scalp. Aside from taking Remag orally, would it help if I massaged it directly into my scalp? Yes, it could. Also, the Renew can be helpful. There are scabby areas with no pustules, but I know someone with the same condition, she's developed an infection. So yes, the Remag, you can rub it in, but also folliculitis like that can be B vitamins, can be related to yeast overgrowth, setting the stage for staph infection of the follicles. So I'd be looking at Realign and yeast detox and the Remag. I mean, the Remag would come into it as well. If you're using Remag solo for a long time, you really have to be careful about the other minerals. That's why I recommend the sea salt water and the Remite along with the treatment. And the Remite actually is going to be important for folliculitis with the zinc and selenium and the different minerals for boosting the immune system. Okay, a question here. We're halfway through the mailbag, long mailbag. I've just started Remag. I have atrial fibrillation. I'm 38 years old. That is way too young. Also suffer from terrible vertigo. That's hard for me to even walk. Looks like I'm drunk sometimes. Okay. Gets worse around my menstrual cycle. Take 2 teaspoons every other day. Okay, here, what's she saying here? It's just been a month, I believe. I'm not sure if I'm doing it right. I take 2 teaspoons every other day, and I get a flip-flop in my chest. Still wondering if you recommend taking Remite as well as the medication. I take Metoprolol, but it's raised my A1C level, and now I'm pre-diabetic. I want to be off that medication. It's horrible. My blood pressure seems to be higher. She's noticing the drugs are affecting her. So taking Remag every second day, 2 teaspoons, is not enough. I mean, for all those symptoms, you need to be sipping your Remag every day, 2 to 3 teaspoons, and the Remite 1.5 to 2 teaspoons every day, and probably they realign and RNA drops. RNA helps sugar metabolism, so it'll help with the blood sugar. I know it's the drugs. My doctor also recommended me to take Maltag, but I'm so afraid because it can cause liver failure or death. I'm also not on an anticoagulant because I suffer from uterine fibroids, which make me bleed heavily, and now I'm anemic. And so she was asking for a dosage of Remag and Remite. So we've gone over that. Now, Maltag, let me quickly look that up. Dronabinol. Oh, it's for cardiac arrhythmias, and it's not a fluoride drug. Yeah, that's a fairly new one to me. Okay. Yeah, they'll keep coming up with more and more drugs, I'm afraid.
Listen to this, Carolyn.
Yep.
The no kids theme. Jenny says, "Me too, Bob. No kids, just dogs."
We even go further. No dogs.
No, wait a minute. No, we do. But she says, "No kids, just dogs." Then Romy says, Jenny, me too. They agree with me, but no dog. So then Jenny says, this is not Jenny, 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 says, "That's even better, Romy." And then Romy talks about her mother-in-law, sounds like her mother-in-law. Then Romy asks Jenny, "Better no dogs, you mean?" And Jenny says, "Yes, they can be a pain sometimes too, even though I love them so much." Then Jenny says, "My dogs give me much pleasure, Romy, but are a big responsibility. They're really a luxury, better than kids." And then Ginny, your colleague, my colleague here, says, "Jenny, I agree with you, Jenny. Love my dogs." Oh, and kitty cat. Less expensive, too.
Okay, this is not payday where you read from the chat line.
Oh,
I know you're very excited, but just thank you.
Somebody agree with me.
Thank you for the breather.
I'm healing people.
Something for the...
I'm healing people.
Right. Thank you, Bob. As a new subscriber, 85 years young, I have recently been diagnosed with chronic kidney disease stage 2. I'm interested in any of your writings dealing with kidney issues, how best to go forward. I'm a healthy eater, etc., etc. He's doing his bone broth soup and with using grass-fed bones. Want to live to 100, so this is a stumbling block. Just happened recently. The kidney diagnosis. Ordered your Remag. Anything else I should order specifically? Yeah, it's interesting about this stage, the stages of kidney disease. I think they changed their lab testing, so now they can put people, stage 1, stage 2, stage 3, stage 4, and, dead. And I don't know what it is. I think partly, and I've wrote about it in the new edition of Magnesium Miracle, which I finally handed in. I worked on it for 6 months, or like 6 hours a day for 6 months straight. I was overworked. So anyway, in there, I'm pretty sure I wrote about how they're saying from, 1 or 2 studies that they've done that, we can keep people from going into further advanced stages of kidney disease by giving them antihypertensive, cholesterol drugs, and glucose medication, And that's a preventative approach to kidney disease. And it's just so frustrating because what it's doing, what those drugs obviously are going to do is deplete their magnesium and, cause other issues. And they're hardly going to help the kidneys. So what they're trying to do is keep the blood pressure from being elevated to put pressure on the kidneys, et cetera, et cetera. What I told this gentleman was to go on all 4 formulas, read my articles about the use of Remag, the Pico or the Angstrom magnesium, is what I started with, the angstrom, but that's so low concentration. Of course, when you have the Remag now, that's going to go straight to the cells, help all your magnesium deficiency symptoms, and then Remite is going to help heal the kidneys themselves. So, yeah, kidney disease is now getting epidemic, and it's because they're diagnosing it more with their tests and putting people on preventive medications. Here's a cancer question. I finished receiving chemotherapy treatments a year ago, June. I have residual neuropathy in my feet and fingertips that continues to worsen. I've been taking your Remag at the therapeutic doses for 2 to 3 months now, but do not have any improvement. Can you suggest what else I might be doing? To detox from the chemo, I've taken coffee enemas, infrared saunas, castor oil abdominal packs, kidney flushes, liver flushes on a regular basis, drinking Essiac tea every night, doing a pancreatic rebuilder. Acupuncture still determines my liver has low energy. And I'm saying to soak your feet in Epsom salt, spray your feet with feet and fingers with Remag. Make sure you're on at least 3 teaspoons a day of the Remag, and be on the Remite, Realign, and RNA drops. I sent her the spray facts. Did you know that 1 milliliter is 8 sprays, 5 mils is a teaspoon, so 5/8 are 40. 40 sprays is a whole teaspoon. And a quarter teaspoon is 11 sprays. So 11 sprays 4 times a day is good to start with. That's how I define the whole spray, Remag spray facts. I don't know if I sent you that, Judy. Is that something new too? Okay, so that's, okay.
That's in our thingy.
Okay, good.
Yep, we've got that on the website. It's in the protocol. You did that before.
Okay, good.
Yeah.
Next one. I read your wonderful book, Magnesium Miracle, last year. Was amazed, started taking magnesium, had some fabulous results. I started November 2015, worked up to the doses you suggested quite quickly. This year I noticed whenever I took the magnesium, I would get a very bad calf muscle discomfort. Keep me awake at night, persisted for a few months. I thought I read that when the body needs the magnesium, it can become more irritated. Didn't seem to improve, reduced the amounts I took. Now, this is a person that should have gotten in touch with us, much sooner. I don't want to stop, but I'm confused as to why this should happen so persistently. In total, I've been taking magnesium for 6 months before I stopped. The results I had included much stronger nails, no constipation, both a lifelong issue, regular periods, reduced breast pain, reduced depression. The calf pain has been too much to overcome. Would you shed some light? And actually, I'm reading that, and then Ginny answered this and sent me a copy. So this is how smart Ginny is. And, just how compassionate. Listen to this. Fortunately, your problem is very easily solved. Now, doesn't that give someone confidence right there that they're going to be helped? After 6 months getting the benefits of magnesium, your body may want to balance the other important minerals with the magnesium you're getting through Remag. Are you using the Remite? This is a great addition to your protocol. Also, are you getting enough calcium and potassium? Remite contains both and can be a great benefit. Finally, you could require some local magnesium in your muscles, in which case you use the Remag topically by massaging a few drops into your calves before bed. Please email me so I can send you Dr. Dean's free ebooks, and we'll explain all this in great detail. But just know, a few simple adjustments and you're back on track. Isn't that sweet? And did we hear back from that person, Ginny? I mean, I don't know if it's long enough to know.
Oh, she did. She initially said thank you, and then I don't know how it's working. I haven't followed up.
Yeah, no problem. And yeah, we do encourage people. I mean, for us, it's kind of a challenge, and it is important for us to know if you have any problems, because that's how we find solutions and know what's going on. This is about weaning off medications. Yes, I think this woman is 85 years old. She said, I think I must have withdrawn my diuretics too soon. I feel so weak and out of tune. Cut back from 2 diuretic pills to 1 after 3 weeks. It's after reading their side effects that I was determined to stop them as soon as I could, and I felt they were not needed. Then she wrote back right away. This is a day when I got 12 emails from this customer. Thought I should let you know it's an hour after going back on full 2 pills, and my walking is totally different. So yeah, what we always say to people is you really do not want to stop your medications until you feel so good that or any symptoms you've been having on a daily or even weekly basis no longer occur, and then you can wean off your medications, but really slowly. So that, I went into some details about what she's on, that, whether or not it was a fluoride drug, and just to work with her doctor on slowly reducing them. And, I've seen, looking at benzo withdrawal websites or even books on medication abuse and how to deal with it. Most of these doctors will not give a withdrawal protocol because everybody is so different. And that's where I think the complement formulas are so awesome, because you can take them along with your medications. There is no contraindication, and they'll just continue to make you feel better and better. And then when you're so much better, and you figure you're just wasting extra Remag by taking them along with your drugs to help with the drug side effects, that you just naturally can wean off your drugs. We were never meant to take these drugs for more than a couple of weeks of time until our bodies clicked in and started taking care of ourselves. So we've
got a couple phone calls, Carolyn, and also a couple questions. Last week, Rami reminded me that we had a question come up on the chat that we didn't get to, which is there a therapeutic magnesium to help the pituitary gland? Do you spray?
Right, I might have been answering that into the music. Well, the pituitary, they say problems with the pituitary can be caused by pituitary calcification. Anything to do with calcification, it's Remag. It's therapeutic doses of Remag that will decalcify the body. Like, what is there a decalcifier in the auto industry? Yeah, this decalcifies the body.
Very good. Excellent. Diane in San Clemente typed in and said, I love the complement formulas, but sorry, guys, I love dogs and wouldn't know how to live without 1 or 2. We love dogs, too. Carolyn doesn't seem to have a dog, though. That might be her one flaw.
I have plenty of toy dogs.
Oh, okay. Very good.
I sleep with a toy dog, and I have a Snuffles dog, and I have,
She has me, Ginny.
And I have
dog you can kick around and he doesn't complain.
Yeah, Bob. Yes, that's right. That's right. Very good. Okay, let's go out to Washington State, I think, for a quick phone call. Area code 425. 425, you're on the line with Dr. Carolyn Dean. If you could give us your name and state your question or comment.
Sure. Hi, my name is Tyler. I've called in before. I love all the complement formulas. I had a couple questions, though. I work with a guy. His name is Mike, and he's an older guy. He obviously has a lot of deficiencies and whatnot. He was in a car accident a while back and had a kidney removed. So I'm sure the answer is at least Remag, if not all the complement formulas. But I'd wonder if you could just talk about that a little bit. And if you've already talked about it in the Magnesium Miracle, I have it coming, and it's due here on Wednesday. So forgive me if you've already covered that.
Well, I don't mind, quickly covering it, Tyler, because you're being very compassionate, asking for your friend, and basically everybody is pretty deficient in minerals, and right. After an accident, where bones and muscles are involved, in order to heal them, build back those muscle and nerve cells, you do need the building blocks, which is the Remag and Remite. And with the kidney removal, what some doctor might say to him if he asked about, should I take magnesium? Oh, no, you only have one kidney, and magnesium is not good for the kidneys. And, I don't know where they developed that. I'm pretty sure it's when they use intravenous magnesium, you can overwhelm the kidney's ability to clear the magnesium, and then you get high levels of magnesium in the bloodstream that affect the heart. But to apply that to just taking an oral, well-absorbed magnesium, compared to IV magnesium, it's crazy. And that's what they've done. And every piece of literature you read talks about the dangers of magnesium in the kidney. So if you get Mike to take the Remag and Remite, just warn him that, read this article in. I do talk about it in the Magnesium Miracle, but you can download the Remag book for him and print it up and point up the kidney sections. But don't bring it up, as a problem. Just say these are solutions that have worked for so many people to build up their cells after an accident. The Realign, if you feel he's really toxic, the RNA drops. Definitely, I'm sure he's, not really in a good mood all the time from what he's gone through, and the RNA drops can really help with that.
Right. He said he had a history of drinking and drug use, and that the whole nine. So I'm sure there's toxicity there. Mm-hmm. Okay, so also one more quick question in terms of, and again, if you already covered it in the book, please forgive me, but in terms of diabetes type 1, I'm not real clear on the difference between that and type 2. And I'm assuming the answer is yes, but do the complement formulas help, alleviate that too?
Well, type 1 is usually in younger people. It's damage.
It's for his son. It's for his son.
Oh, yeah. Type 1 is usually younger people, damage to the pancreas, sometimes from a viral insult. Magnesium can be helpful, though. I've seen people with type 1 on insulin who cut back on their insulin when they take the Remag and Remite. So that's pretty wonderful. And the neuropathies that people can get with diabetes can be helped with magnesium. Type 2 is easier to deal with. It's more dietary and magnesium deficiency. And we know that one of the signs of diabetes is low magnesium levels in the blood. So that's a no-brainer to use magnesium in type 2 diabetes.
Okay. Sounds good. Well, thank you very much. I appreciate it.
Okay. Thanks for calling in and helping out your friends. That's very sweet.
Well, I'll be calling more and more and more.
Okay, great. Yeah.
Thank you.
Bye-bye. Bye-bye.
Very good. Very nice phone call. Okay, excellent. Anything else we have to do mailbag-wise, Carolyn?
Oh yeah. Never stop the mailbag.
Okay.
And it's good. It's a holiday, and people will get to the archives later, so I can get the mailbag going. Help! I recently developed a very annoying neck twitch tic. I've been on your Remag and Relight for about a year and had great success. I ran out and have been out of it for about 3 months. I reordered it today. Went to the chiropractor. He said he didn't think it was my neck, wanted me to see a doctor, thought it might be something neurological. Now, she has the experience where it went away with her, I think, I may not be reading this right. It sounded to me like she had great success with the Remag and Relight before it was Remite, so you know how long ago that is. And I don't know if that improved her twitch and tic back then or if this is something new. But twitches and tics are magnesium deficiency until proven otherwise. But the chiropractor is covering him or herself and wanted her to see a doctor. Haven't gone that route yet. I don't want drugs. I've been using Magnesium Calm, any insider advice. And so I said, I can't examine you, but you've been off your magnesium and have magnesium deficiency symptoms, muscle tension, nerve irritation. So to me, it's a magnesium deficiency until proven otherwise, which means Remag, Remite, sea salt and water, get better, don't fall victim to doctors trying to tell you it's something bigger. Magnesium deficiency is a big enough problem, but all you have to do for it is take your Remag. So that's what I wrote, and we'll see if she gets back to us on that. Someone writes about, and I have it labeled as anti-statin testimonial, but it's 2:58. The music will be coming on, so maybe we're going to have to say goodbye.
What a great show, Carolyn. Thank you so much. I hate to say goodbye, but fantastic information you laid out tonight, and just such a pleasure to have you once again. And Bob, of course. Very, very good show. Excellent. Thanks, Bill. Thanks, everybody. Thanks for tuning in on the holiday.
Yeah, thanks, Ginny. Thanks, Bob. Thanks, Bill.
Thank you very much, Ginny.
Awesome.
Happy Easter. That's the holiday now? Easter? Are they doing Easter?
You've been listening to Live with Dr. Carolyn Dean here on AchieveRadio.com. Till next time, so long, and thanks for all the fish.
AchieveRadio.com. Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
When it's much more simple than that. You have a physical body. Your physical breathing, blood pumping, mucus creating physicality that has access to non-physical. And everyone has that inside them. That's how the coroner can tell if you're deceased or not.
Very, very, very good. For we are eternally, completely, deliciously, forever a great big old Tom